Hey, this is Kay. So let's talk about today. And as we are living through this world of the coronavirus, this is the Coronavirus Introspective. And I'm here with you nightly, most nights. We'll see so far. Following this little trend that I've been doing, going to start off with some data. According to Worldometer, today on March 23rd, Monday, as we're entering our second week of, for a lot of people, it's our second week working from home, second week of practicing social distance and social isolation. Worldometer.com .info is reporting that around the world there have been 378,400 cases of the coronavirus, and we have unfortunately lost 6,500 people. And the US is now reporting 43,500 cases, y'all. 43,500. Last Monday, I can tell you how much we had last Monday. Last Monday, we had, sorry, you're going to have to wait for me to flip through all of these pages because this is important. We had 4,663. Right now, we're 43,500. That's damn near 40,000 case difference. Again, a lot of that is because we are testing more now. Still not everybody. They're still saying, only get tested if you're showing symptoms and if you're at risk. Also very much depending on where you are. But in the US, we now also have passed the 500 mark of the deaths. We're now at 545 victims that we lost. You notice today I'm again trying something different, and you see me at a different setting. Still my place, still my apartment, a little bit of the view of, the neighbors behind me. Sometimes I grab this pair of binoculars over here. It's like I'm playing. Yeah, I'm not that creepy, but I do have them here. But I'm doing this to show off the fashion a la home quarantine. Fashion a la I never have to leave my house, a la mode. Sweatpants, socks, slippers, doing it just like this, rocking it. Look, gotta have some fun somehow, right? As we do on every other show, let's talk about a little bit of positivity, a little bit of light that we see around the world, around the United States, around the world, a little love and light that we're able to share with each other. And one of the biggest stories that touched me today is people at home making masks, making homemade masks, making face shields and other supplies to donate to their local healthcare workers. This one couple that I saw in the news, man, I wish I had names for y'all. Next time I'll do better research and actually come up with real names. But this one couple that I saw in the news this morning leads an at-home printers group. So essentially a private community of people with domestic 3D printers. They've all banded together and they're making full-on face shields that they're giving out to their local hospitals and medical facilities. And also there's a DC native, don't remember her last name, but this little girl, I don't know, maybe she's 12. Her name is Skylar, and she has a company called So Fly Sky. And that, you know, she's a little fashionista. She normally sews clothes and, you know, has a fashion line. And right now she is making, mind I say, very cute, very fashionable masks that she's also donating to our local hospitals here in the DC region. And not to mention, I believe earlier today she posted a live IG, a live Instagram on how to do this yourself at home. So I think you can probably look her up on IG, So Fly Sky, so as an SEW. Thought it was very cute. Honestly, I may go on there and buy one from her because she's also selling them and using the proceeds to get more material so that she can donate more. So I may buy one because they're so cute. Can honestly be true, you know, the fashion statement in the age of Corona. And I saw earlier on my personal Facebook feed that a friend of a friend, I hope I'm not mispronouncing your name, Aidan. She's a friend of a dear friend. She lives in Colorado, and she also busted out her sewing machine over the weekend and started sewing up, making masks to donate to her local medical providers. In other news, something else that we can all be hopeful about. Do you remember that drug that I talked about in one of my former episodes? I talk like I've been on for years. It's only the second week. It's called hydrochloroquine. So officially, the drug has officially been proven to help treat with the coronavirus if you get it. It helps ease the symptoms. It helps make you better, and it has now been approved by the HCA. So I'm hoping that they're going to be ramping up production, you know, in the States. Hopefully it's already available in other parts around the world. The drug is commonly available in places like Africa, where malaria is a more common disease, because that is what the drug known to treat. So if you actually look at the statistics, you'll see that they have so far, you know, knock on wood, coronavirus has not been as prevalent over there, or the spread of it hasn't been as severe, because hydrochloroquine is so much more abundantly available there anyways. I wanted to take the time today to specifically give a huge shout out, a huge thank you to all of our medics, the hospital workers, the doctors, the nurses, all of the other supporting staff, you know, whether you're working at the front desk, whether you're doing triage, whether you're transporting the gurneys, you know, patients from one room to another, the paramedics, the doctor's offices, everybody involved. I know you guys are so exhausted right now. I know there's not enough resources, too many sick. Your hospitals are overcrowded, overrun. It's only getting worse. You're running out of supplies, and you're going out there every single day, completely overworked, risking your lives and your family's lives by helping us combat this disease. So I just wanted to acknowledge that and say thank you from the bottom of our hearts, from all of us, from all of my neighbors over here behind me. Thank you. We appreciate you. So, Trump just finished his press conference, And I don't know how much attention you've been paying, as much as I'm usually attuned and, in the news, in the now. Honestly, I just can't keep up with every single news conference, but this is what I saw happen today. So, he talked about how, we all got to get back to normal, right? Sure, we do. We got to beat this thing first and then get back to normal. And how he plans on reopening the country. He's, I think he's saying in about a week after, he said the 15-day shutdown or the 15-day kind of, isolation period that we were trying. So a week has passed. There's another week left. Mind you, not a single doctor, at least not that I have heard of, has approved this, has said that it's a good idea. Nobody. We're not even at peak yet. Cases are still growing. People are still getting sick in massive numbers. It's only going to get worse. 1 week is not enough time. Virginia public schools, or maybe it was Loudoun County only, I don't know, but schools in Virginia that were supposed to be closed through the beginning of April have now officially extended this until essentially said the schools are not going to go back this year at all. I'm sure a lot of other schools are about to follow suit. My company, where I work at AARP, we have just extended our remote work for another 2 weeks until mid-April. And over here, there's the President of the United States coming on, talking about, there's going to be more deaths because the economy is going to be bad, and it's going to be more deaths than the virus. Really? More deaths from the economy going bad than from the virus? Okay, Dr. Trump. Listen, I'm not making light. Mental health is a real issue. The economy is in shambles, and that's going to be really, really hard for a lot of people. And unfortunately, the reality is, there will be some folk that unfortunately may not be able to handle that. But to say that you're gonna lose more people to that than to this virus that has overcrowded our hospitals, that, in Italy, they're already, they have to make calls like, if you're over 60, you don't get a hospital bed. That's it. They're out there to save the young just because there's not enough resources to save everybody. And he goes, well, I feel like over the last week, we've learned a lot. So I think we can open the country back up because we've learned a lot, we'll learn a lot about social distancing. We'll learn a lot about hands. Hands? You've learned a lot about hands? My hands are bigger than yours. See? But I can't go on about that fool. I do have a public service announcement, PSA, very important. I don't know if there's data behind this either. So again, full disclosure, I don't know if what I'm saying is backed by data, but it is backed anecdotally. And again, better safe than sorry. If you are sick, if you do get sick, do not take ibuprofen. Do not take anti-inflammatory drugs like ibuprofen to make yourself feel better. Don't take Advil. Advil is made with ibuprofen. Cool? Take acetaminophen. I think I'm pronouncing that wrong. Take acetaminophen. Tylenol. Take Tylenol. Anecdotally, and okay, this one is coming. My mother works, she's a contractor at the NCI, which is part of the NIH. By now, if you don't know what the NIH means, shame on you, because NIH is doing all of this fantastic research, and Dr. Fauci, who is the leading medic, on this pandemic, he's from the NIH. But either way, my mother is a contractor at NIH, and I guess in a listserv, somebody, a colleague of hers, has shared that a colleague of hers from Vancouver, I know, he said that, she said that, she said, either way, yeah, they've pretty much said that, a lot of younger people that they were getting sick, completely, no pre-existing medical conditions. They were getting sick and they started taking ibuprofen and it actually worsened their condition. So whatever you do, don't take ibuprofen, don't take Advil, take Tylenol. Look, the truth is, I wanted to keep today light, right? We've talked about more or less real subjects, last week. We've talked about fun ones, we've talked about serious ones. And, right now we're embarking in our official second week of doing this. And it's only going to get worse. First week is easy, right? Just 1 week. It's like a vacation, like you get sick, everybody gets sick, that everybody, has to stay home for a week from time to time, not a huge deal. Second week, okay, second you're doing, by the end of this week, I'm assuming all of us are going to be a lot more restless. But 2 weeks, usually is not a huge deal breaker either. Um, but we're looking at a lot more of this. Um, so I just want to say, stay strong. We're all in this together. We are alone together. New hashtag started. Um, Me and all of my neighbors here, we're all alone together. Um, this is the new normal, and the new normal is continuously evolving. So we're going to make it through this. Stay healthy, stay safe, stay vigilant. Love and light.